Hey everybody, this is Amie Clark with theseniorlist.com, and today I'm here with Nurse Cynthia to talk about home care. Cynthia used to work in home care, correct? So you are like an expert in all things
I've
home
seen a
care.
lot of home care in my days
Yeah.
in many
Okay.
different ways. So yeah.
Okay, so first, before we get into the home care
Mhm.
stuff, just give us a brief background about your experience in home care, and then tell us what home care is for people who may not know.
Yes, absolutely. So I had the privilege of supervising a home care program. It was a startup program back in the day, and so I learned a lot from that experience. I really enjoyed it. I've seen a lot of different scenarios in home care. And then throughout my time working in senior care and in an assisted living community, we worked with home care a lot. Even within the community, we had home care come in quite a bit. So safe to say, I've been experiencing and working with home care agencies for about 18 years now. So
Hmm.
it's been great.
Okay, so, and that's interesting that you bring up home care being used in a community setting, because I think most people, when they do think about home care,
Hmm.
just think about it being used in the home, but home is wherever we are.
Yes.
So
Yeah.
home can also be in an assisted living, and people can have home care there. So
Mhm.
in regards to home care, what is home care, just, kind of at a basic level,
Mhm.
and to tag on to that, who pays for it? That's usually the second question that I get from people is, okay, what is it? And then
Yes.
who pays for this?
Yes, so home care is generally going to be private pay care provided in the home. Home care workers, and like we just said, it can be an assisted living situation or independent senior living. I see that a lot. And then out in the community in your own home. Generally, home care is paid for out of the pocket, but I'll talk about a couple of other things along that line here in a minute. Um, what does home care do? Home care is support within the home that can come in and help with just a huge variety of activities of daily living. Some folks get home care, kind of earlier on in their aging process, so to speak, and they might just need some assistance with transportation or meal cooking, companionship, things like that, running errands, going shopping. And so it can vary, greatly as to what types of care are provided in the home. And then as we age and need more assistance, home care can be very extensive. It can be assistance with medications, it can be assistance with bathing, dressing, toileting, grooming. And so there are all types of levels of assistance that you can get within the home, and it's wonderful because it allows people to age in place and be safe and give them the support that they need at the same time. One thing I want to differentiate is the difference between the terms home care and home health.
Oh, good, because I was
Yeah.
going to ask you that.
We hear those
Me too.
two, and then oftentimes you'll see an agency that provides both services, which can be a little bit confusing because they may say we provide home care and home health, and folks are like, what's the difference there? Sounds like the same thing. So home care is, like I said, generally private pay and it's assistance with activities of daily living. Home health is insurance pays, whether you have private insurance or you have Medicare insurance, and it's specifically referring to skilled services
Mm.
such as nursing assistance. Maybe if you have a wound, a surgical wound, or some type of wound that you need care for within your home or even your assisted living community, physical therapy, occupational therapy, and speech therapy. And so the difference between the two, one is home care, and it's more for assistance with activities of daily living. The other, home health, is for skilled services, physical therapy, nursing, and then, of course, private pay versus your insurance or Medicare. paying for home health.
I think that's a really great distinction, is who pays for it, because as you said, home health is generally paid for by Medicare or private insurance. So that does help people keep the differentiation between the two. And also that home care is more of a custodial care. It's something that's probably going to be ongoing, long-term, versus a skilled need, as you mentioned before, which is generally a short-term, requires proof of progress that someone is improving or getting better, requires a physician's order to get in place. There's a lot more that goes into home health as far as qualifying for it, getting it paid for, getting it in place, than, say, home care.
Yes, that was very well defined right there. Yeah, it's more of an ongoing, home care is more of an ongoing, and it's just mainly activities of daily living assistance. And the great point that you mentioned is that you do need a doctor's order to have home health, but you do not need a doctor's order for home care.
Yeah.
So big difference there. And then back to payment for those services. One thing that's really important to mention is generally home care is private pay, meaning you are paying for it out of your pocket. But for individuals that have Medicaid services or individuals that have a long-term insurance care, there might be benefits there. Definitely usually for the Medicaid individuals receiving Medicaid. But if you have a long-term care insurance policy, it's really important to reach out to your carrier, your policy provider, and ask them if there are benefits within your policy to cover in-home care, which is generally out of pocket. So there can be some benefits there.
Okay, that's great. That's a great point. Sorry, I'm just jotting down some notes here that I hadn't thought of before. Back to home care, what types of skills or qualifications do home care providers need to have?
Great question. So that's going to vary depending on the state. I know that I was part of, when I was part of the home care program that I worked with, the state of Oregon had just started to regulate home care services. And so we were learning kind of all of that as we were going along and opening this home care agency. But there are a variety of services, and you're also going to see a variety of skill levels. One thing that I really like to point out is oftentimes companies will differentiate between what a caregiver does and what a companion does. And some companies might only offer companion level care. And so typically when you're talking about companion care, what I think of and what my experience is it's more so somebody being there to help with really basic things that are not personal care to our physical body. And so it's going to be things like shopping, transportation, running errands, maybe doing some cooking and some cleaning, but not actually providing personal hands-on care to the individual. And so there are companies out there that is the level of service that they provide. And then there are agencies out there that provide companion level care and then also personal level care. And so obviously the training and the experience that those individuals have is going to vary depending on what type of care they're providing. Most individuals can have very little experience to be an actual companion. You know, they're helping with things that we're doing every day. And certainly most states have training topics that companions have to receive education about from their employer. If you're needing somebody that's going to be more of a caregiver, a personal caregiver, and is going to assist with personal tasks such as bathing and dressing and toileting, those individuals are going to need more education, more training, should be more experience. And it's really going to vary with each state. And it's a really great question to ask a home care agency about. And even, if you feel comfortable getting on the computer and looking up the requirements in your state, just kind of breezing through those to see what your state requires for folks that work providing companionship or care within the home. Typically, if you're having somebody that is providing personal care, you want somebody that knows what they're doing, obviously, somebody that has some experience and that has been trained in, how to work with somebody in getting somebody dressed that's possibly had a stroke and has some weakness, or safe transfers from a wheelchair to maybe a shower chair, and things like that. And so if I was to hire somebody that was providing myself personal care, I would definitely want to inquire about what kind of training and experience the individual caregiver has.
Yeah, absolutely. One thing that I thought about earlier is that, and this will depend on the market that people are in, but there are, as you referenced, home care agencies, which are businesses whose job it is to provide people to your home, and the agency takes care of hiring those people and paying their taxes, and essentially they're employees of the home care agency.
Correct.
There are also other models that I was familiar with that were a little bit different. Those they were more like a registry, so they would help match families with caregivers that they had, referenced, checked out their references, they had vetted, they perhaps had worked with them before, but the client, client in the home ended up paying the caregiver directly. One thing I remember hearing from those caregivers is that they were paid at a higher rate than if they were working for a home care agency.
Correct. Yes.
And I liked that model because the registry, it seemed that they could really help match personalities, likes, dislikes, views, that kind of thing from the client to the caregiver. So I always thought that was really interesting. What would be your advice for families who are working with a traditional home care agency and they're finding that their loved one and the person that they've been assigned to aren't really getting along, that there's a personality conflict or there's something else going on, but things are not working cohesively with the caregiver that they've been assigned?
And that's a common scenario that comes up. And I do just want to say really quickly, back to the registry that provides kind of connections with care providers out there. Typically those registries have done that background check, and they may or may not. So that's something you want to ask about. But I personally have had really wonderful experiences with caregivers coming into the home through a kind of a registry type system like that. And I can't say that one is any better than the other. Yeah. I do agree that I think that the caregivers can be a little bit higher paid when they're working through more of a registry. But definitely, I've seen just outstanding care in that regard, as well as outstanding care from home care agencies. And so I would recommend checking out both situations, if you have the time and the luxury to do that, because it can be a really wonderful way. And oftentimes there's a little bit more freedom with scheduling and just kind of working out the fine details when you're working more directly with just an individual caregiver versus an agency. So there's pros and cons both ways, but I've definitely seen wonderful care there. Back to your question about, what happens or what are some tips or thoughts if your loved one isn't maybe connecting with the home care worker. I just say that is common. We're all different. We have different backgrounds, different beliefs. different morals and values, and different personalities. If your loved one is quiet and a little bit more introverted, and their caregiver is a chatty Cathy, it might not work for them.
Yeah.
And so it's not necessarily a bad thing. It's just trying to navigate your way through finding the right person or people for you that fit your loved one's personality or your home, and feel right. And so I try to encourage people not to necessarily look at that as a negative thing, because oftentimes when there isn't a connection there, the loved one, or the person receiving care, they feel guilty, they feel bad, and they don't want to feel like they're complaining, and it's not. And for those of us that work out in healthcare and home care, we get it, it can be difficult. And when you're receiving care from one individual for multiple hours at a time, and they're really in your space, it's really important that you feel comfortable. And not only comfortable, but also that you feel safe. That's something that I always really want to talk about when I talk about home care. When you're bringing somebody into your home, whether your home is in an assisted living community or in your own home out in the community, it's really important that you're looking forward to seeing that person, that you feel good when they're around, that you feel safe, that you feel respected. And so you need to just focus on making sure that, it's a good situation, because that can certainly make or break whether or not home care is successful for you, And so if you have somebody in your home that you're just not connecting with, it's not going to feel like a good thing. And, it certainly needs to be. So finding that right personality is just, it's a roll of the dice a lot of times. But it's not only finding that right personality, it's also finding someone that you feel safe with, and you feel they are trained and can perform the duties that you need them to do. Certainly if somebody's transferring me or my loved one, I want to know that they know how to perform that transfer safely, and that I feel comfortable. That can make or break whether or not I want to take a shower, if I don't feel comfortable with somebody transferring me into my shower chair, And so give your caregiver feedback, be open, be honest. And if things aren't working out, reach out to your home care agency and give them some feedback. We shouldn't feel guilty or obligated to have somebody come in and provide services that we're paying for, even if it's not out of pocket, even if it's through a Medicaid benefit or a long-term care insurance policy. It's really important to have somebody that you feel comfortable and safe with, and that you feel respected, and that you feel like they're trained and can provide your level of care adequately.
Absolutely. That's great advice. What other things, when people are searching for a home care, whether it's an agency or a registry or even someone on their own, what other considerations should they take into account when they're trying to find the right fit?
Mm-hmm. There's a lot of things, kind of bouncing back to the companionship versus the personal care. Mm-hmm. Really being open and honest with the registry or with the agency that you're working with about the type of care your loved one needs. Because if you have a companion in the home and your loved one needs assistance with a shower that day, perhaps, oftentimes the companions aren't able to provide that assistance. And it seems something simple to us, but there can be those differences there. So making sure that you're being very clear as to what types of care the agency is providing, or the home caregiver can provide. If they need assistance with medication management, that's often a little bit of a specialized piece and can have different regulations, and oftentimes will involve a nurse. And so that was something that I did in the home care program that I supervised. If there was medication management, I was involved one-on-one, oftentimes maybe going out and setting up the pill box, or training that caregiver on what's going on with those medications. Mm-hmm. And so medication management, if your loved one's needing that assistance, it's very important that you speak very openly with your agency about that. And also, you know, when you're finding someone to come into your home, you need to make sure that you're asking those questions about background checks. If there's going to be transportation involved, you want to know about driving record checks. I know for my program here in the state of Oregon, we did background checks, we did drug testing, we did driving record checks, and then also asking about the level of training and training requirements. Experience, feel free to ask about the experience. I would want to know if I'm getting a new home care provider and somebody that's new to the field, which can oftentimes be a really wonderful experience because they're open to learning. They haven't developed any bad habits. You know, there's pros and cons on both sides. But I'd also want to, if I had somebody that had some pretty extensive personal care needs, like medication management, transfers, bathing, that somebody's either well-trained or has not only been well-trained, but has a decent amount of experience and has done this before. As far as, kind of comparing one home care agency to another, or some questions you might want to consider when you're looking into home care services is, how is care billed? Is it billed by the visit? Is it billed hourly? If it's hourly, sometimes folks go, oh, I just need somebody to come in for an hour while I go grocery shopping. And some home care agencies have a minimum of maybe 3 or 4 hours of time. Mm-hmm. And so you want to ask if it's being billed hourly or by the visit. Is there a number of hours required per visit? Really how does that work? Another thing that can be interesting, and I even see this in assisted living when we have home care workers come in, is do the caregivers take breaks? If they're there for extended hours, how does that work? Do they get to take a break? If they get to take a break, are they able to leave the home to go out and get food? And just kind of the ins and outs of how that works. And that can be different, state to state or agency to agency, and depending on who you're working with, if you're kind of working one-on-one with an individual caregiver. And I've seen a lot of different scenarios there as well. And then also a really important thing is to address is, what is the process if a caregiver that's scheduled calls in sick or can't make their shift, or if you need to cancel a visit? And so finding out that information, again, most of these folks have been doing this for a long time, and so they already anticipate those questions and will likely be able to answer them before you can even ask. Mm-hmm. But just some kind of little seeds back in your mind. There are no wrong questions. There are no dumb questions. If you're thinking it, thousands of other people have thought it. Ask. This is your home, your time, your money. So get yourself informed. Something that I always think about too are, how are your caregivers supervised? Mm. Because it's really important when people are out in the community working with older adults that they're supervised out in the community. And so how are they supervised? Does the nurse come to the home and supervise that care directly? Those are questions that an agency should be able to answer. And then along the lines of transportation, finding out kind of how that works with that agency. Do you provide the car? Does a caregiver use their own car? How does the insurance work? And so there's a big learning curve, but generally once you get set up and you kind of figure out the ins and outs of it, it can really allow your loved one to extend their time in the home and help relieve caregiver burnout for the person that's providing care outside of those hours. And another thought, when we were talking about caregivers in assisted living, and this could be another video, sometimes hiring a care provider from an outside agency can help supplement services being received in assisted living. And And so I do see that quite often. If somebody is in assisted living and they are needing really one-on-one care 24 hours, sometimes families can supplement and bring in-home care into the assisted living apartment and help with things that, supervision if someone's not safe in their apartment, things like that. And then also a really wonderful service that I've experienced with home care agencies is end-of-life care.
Mm.
They provide some excellent end-of-life care where you have a loved one in the home that's actively passing, and they need a lot of one-on-one personal care and TLC, and it's a great time. And I've seen just some amazing care out there in those scenarios as well.
That's great. I think that's a good reminder for people that home care really can run the gamut as far as the location it's provided in, the scenario that it's provided in, whether it's just, a couple hours of help around the house or it's some really intense end-of-life care. One other thing that I've seen just kind of in the bigger scope of what's happening in the industry is that a lot of home cares are now adding on additional services, like more like additional products, but like a medical alert system for people who are in their care, sensors in the home. I've seen home care agencies that, part of their packaging is sensors in the home so that family members can log in and see when the fridge was open, what time in the morning.
Yes.
It provides a little bit of oversight, I think, for the caregiver. You talked about how are they supervised. So there's a little bit of insight into, what the caregiver is doing for the person throughout the day. It also gives great insight as to what's happening when a caregiver is not in the home. Is mom getting up first thing in the morning, or is she not getting up until 10 o'clock and getting her breakfast? So it's been interesting to watch this industry over the years because there's new things that are coming out that are, putting home care hand in hand with technology, and those two things are pairing up. So just to add that on to what you were saying.
That's an excellent point, and that's one thing that's so wonderful about the seniorlist.com is it really does kind of bring the big picture together, and shows you all those options and how they really can coexist to allow people to stay in their home. We're blessed to be aging in a time where we have a lot of technology and a lot of resources, and the senior care industry has really branched out to offer services to people so that their quality of their life, can be maintained throughout their lifetime. And so lots of exciting information and services and products out there.
Yeah, absolutely. Thank you for the kind words. Well, I think that wraps it up for us.
All righty.
Thank you so much, Nurse Cynthia, for talking to us today about home care. I'm sure in the future that's going to delve off into other topics. I can see some other, interesting conversations we could have more specific to home care, especially the registry versus agency topic. I think that could get pretty detailed, but
yeah,
another day. So yeah, thanks again for coming. We appreciate it. Hope you liked our video today. If you would like to subscribe, there's a subscribe button down below, and that way you'll be notified anytime we come up with a new video. So feel free to
Thank you. Thank you for having me.
Thanks, Cynthia. Talk to you soon.
Okay, bye-bye.
Bye-bye.